Imagine if you had the power to protect yourself from one of the deadliest cancers affecting men today. Imagine if you could protect yourself from one of the deadliest cancers affecting men today. It's something that could save thousands of lives and could be in your power to prevent. Prostate cancer, often referred to as a silent killer, is responsible for taking thousands of lives each year. Yet, it's a disease that doesn't always get the attention it deserves, and for some reason, many people wait until it's too late. But what if there was a way to spot it early? What if you could know the early signs and take action? Prostate cancer is a major threat to men's health. According to the National Institute of Health, it's the most common cancer among men in the United States and ranks as the second leading cause of cancer-related deaths in men. These statistics are shocking, especially when you consider that 1 in 8 men will be diagnosed with prostate cancer in their lifetime. In 2025 alone, more than 30,000 men will lose their lives to this disease, and the numbers are only expected to grow, with over 100,000 men expected to be diagnosed with prostate cancer in the U.S. next year. But here's the twist. This doesn't have to be a death sentence. Prostate cancer can be beaten if it's caught early. You don't have to wait for the symptoms to become overwhelming. In fact, knowing the signs can significantly increase your chances of survival. However, many men don't even think about their prostate until it's too late. So, how can we change that? By raising awareness of the early signs and paying attention to the symptoms before they become severe. Before we get into the specifics of the 12 early signs and symptoms of prostate cancer that most people miss, let's talk a little about the prostate itself. The prostate is a walnut-sized organ, located just below the bladder and in front of the rectum, surrounding the urethra, which carries urine and semen out of the body. This small organ plays a big role in male reproduction, secreting a fluid that makes up about 30% of semen volume, nourishing sperm cells during ejaculation. It also helps with muscle contractions during ejaculation, underlining its critical function in male fertility. Despite its small size, the prostate is vitally important. But here's the problem. Prostate cancer can develop without causing any noticeable symptoms in the early stages. That's why it's often called a silent killer. Most men don't even realize they have it until it's too late. This is why it's crucial to understand the warning signs and symptoms, even before you go for a medical checkup. Early detection could mean the difference between life and death. Now, let's dive into the 12 early signs and symptoms that could indicate prostate cancer. Signs that many men overlook, but which are critical to understand. 1. Blood in urine, hematuria. One of the first warning signs of prostate cancer could be blood in the urine. This symptom, known as hematuria, can be alarming, especially when it's seen as pink, red, or brown discoloration in the urine. In some cases, it might only be detectable under a microscope. Blood in the urine can signal that cancer is advancing, so it's important to seek medical attention immediately. While conditions like urinary tract infections or kidney stones can also cause blood in the urine, it's crucial not to ignore this symptom. Personal story. I have a friend who experienced blood in his urine, but brushed it off as something minor, like a urinary tract infection. It wasn't until he started feeling other symptoms that he realized it might be something more serious. He was diagnosed with prostate cancer in the early stages, and the doctors were able to treat it successfully because he paid attention to those early warning signs. 2. Difficulty urinating. If you have trouble starting to urinate, or if your stream is weak or interrupted, this could be a sign of prostate cancer. The cancer can press on the urethra, making it harder for urine to pass smoothly. Difficulty urinating is a classic symptom of prostate issues, and it should never be ignored. 3. Inability to urinate while standing. An unusual sign of prostate cancer is the inability to urinate while standing. This might sound strange, but prostate cancer can cause the prostate gland to enlarge, which in turn presses against the urethra. This can make it difficult for men to urinate standing up, and they may need to sit down instead. 4. Burning sensation during urination or ejaculation. A burning sensation during urination or ejaculation can be a serious sign of prostate cancer. While it could indicate other conditions, like a urinary tract infection, this burning sensation may also signal that the cancer is irritating the urethra and nearby tissues. If you experience persistent pain or discomfort, it's important to seek medical help. 5th. Frequent urination, especially at night, nocturia. Waking up multiple times at night to urinate is known as nocturia, and it's a common symptom of prostate cancer. While it's normal to need to use the bathroom more often as you get older, a sudden increase in nocturia could indicate an issue with the prostate. If the prostate enlarges, it can put pressure on the bladder and urethra, leading to more frequent urination at night. 6. Unexplained weight loss. Losing weight without any apparent reason is another warning sign that something might be wrong. Unexplained weight loss can be a subtle symptom of prostate cancer, especially in its later stages when it spreads to other parts of the body. Cancer affects metabolism and increases energy demands, leading to weight loss. 7. Pain in the bones. Bone pain, particularly in the spine, hips, or ribs, can be a sign that prostate cancer has spread to the bones. This type of pain often doesn't go away on its own, and it can range from a dull ache to a sharp, stabbing sensation. Persistent bone pain should always be investigated, as it could mean the cancer has reached an advanced stage. 8. Fatigue. Persistent tiredness that doesn't improve with rest could be a sign of prostate cancer. This type of fatigue is different from typical tiredness. It's an overwhelming exhaustion that can interfere with your ability to perform daily tasks. It's caused by the body's response to cancer and the energy demands of tumor growth. 9. Blood in semen. Hematospermia. If you notice blood in your semen, it's essential to seek medical attention. Blood in the semen is known as hematospermia, and it can be a sign of prostate cancer. The cancer may cause damage to blood vessels in the prostate, leading to blood leaking into the semen. 10. Weakness or numbness in the legs or feet. If cancer spreads to the spine, it can put pressure on the nerves that control the legs, causing weakness, numbness, or tingling sensations in the legs or feet. This symptom can be severe, making it difficult to walk or maintain balance. 11th. Pain in the pelvic area, lower back, or upper thighs. As prostate cancer spreads, it can cause pain in areas such as the pelvic region, lower back, or upper thighs. The pain may radiate from the prostate to these areas, which could be a sign that the cancer is affecting the bones or lymph nodes. 12. Erectile dysfunction. Lastly, erectile dysfunction, ED, is a common symptom of prostate cancer. This can occur even if the cancer hasn't directly affected the erectile function, but rather due to the effects of prostate cancer treatments like surgery or radiation therapy. If you experience ED without an apparent cause, it's important to get checked out by a healthcare provider. Causes of prostate cancer. So, what causes prostate cancer? This complex disease occurs when there are changes in the DNA of normal prostate cells. These changes can happen during a person's lifetime or be inherited from their parents. While there are some inherited mutations, the majority of cases involve acquired mutations that happen randomly. Risk factors for prostate cancer. Several factors can increase the risk of developing prostate cancer. Age is the biggest one. Prostate cancer is most common in men over the age of 65. Family history also plays a role, as men with a family history of prostate cancer are at higher risk. Other factors like obesity, diet, and even ethnicity can also influence your risk. Preventing prostate cancer. Although there is no surefire way to prevent prostate cancer, there are lifestyle changes you can make to reduce your risk. These include maintaining a healthy diet, staying physically active, avoiding obesity, and getting regular checkups with your doctor. Final thoughts. The key to beating prostate cancer is early detection. It doesn't have to be a death sentence, but it does require men to take action. Recognizing the early signs, making healthier choices, and seeking regular medical screenings can dramatically improve your chances of survival. Let's not wait until it's too late. Take charge of your health today.